resuscitation room and delivered for these multidisciplinary groups. And then they were tested again in 3 months' time and scored both for their technical expertise and their teamwork. And this was done blinded to the knowledge of intervention. And it turns out that for both scenarios, the control hospital and the intervention hospital were performing at roughly similar levels for both scenarios. But after the intervention, the technical scores in both scenarios went up substantially. So 3 months after the intervention, these professionals were doing better with their technical skills than the control hospitals, and a similar improvement in team performance with the use of this. Some training with multidisciplinary teams can effectively improve technical skills and teamwork in neonatal resuscitation. And this, I think, points the direction we should all be going when we're teaching our younger nurses and doctors and maintaining our own skills in neonatal resuscitation. Now, what about high fidelity versus low fidelity simulation? One of the criticisms of simulation is that it doesn't really reflect reality, and it's a much different scenario, resuscitating a dummy that is lifeless to a real baby. And the thought is that more realistic or high fidelity simulation might improve the training environment, might make it closer to the real life of the delivery suite. So there's 5 studies that have looked at this issue, high fidelity versus low fidelity, are that yes, high fidelity simulation improves learner satisfaction and confidence. That's nice, but perhaps more importantly, they found 3 of those studies found no difference in either the teamwork or the clinical skills between high and low fidelity methods of training. What about training courses? Here we go to the Cochrane Library that compared standardized formal resuscitation training programs to reduce mortality and morbidity, so real life important outcomes. And these training programs have been administered in resource limited settings. Wally Carlo's done a wonderful job here, and what he's demonstrated in community-based cluster randomized trials, all performed in developing countries, many babies, but this does reduce mortality. And that is quite an important finding in the overall spectrum of neonatal research. This is where the lives are going to be saved. There are new techniques that are under development that need to be properly assessed. Things like teleeducation become much more important in times like these. There are new cognitive aids being developed, apps, etc. And the role for booster courses, short, sharp boosters to maintain our skills and knowledge, makes sense that these should be effective, but they need to be tested in proper trials. So, in summary, I'm going to wrap up now. Good mask technique, it's important, it's vitally important, and it can be taught. Video laryngoscopy, it's a great colleagues. You don't need to spend a lot of money on simulation exercises. Low fidelity simulation is probably as effective as high fidelity. And most importantly, in a worldwide sense, formal resuscitation courses improve mortality rates in resource limited settings. So with that, I'm going to leave you back to Dina and our next speaker, and I look forward to some questions later on in the evening.
Thanks, Peter. Yes, we're taking the questions for the last 15 minutes of this session. And I have the pleasure today of introducing Dr. Satyan Lakshmi Narasimha. Dr. Satyan is the endowed Nancy and Dennis Marks Chair of Pediatrics. He is a pediatrician-in-chief in the University of California, Davis Children's Hospital. He's a renowned neonatologist and a great contributor, and I guess one of the landmarks when we talk about Dr. Satyan is his newly released textbook of Essential